Today I want to talk about the issue of shopping during the lockdown period. Now, we know that there have been a number of restrictions during the lockdown period which have quite significantly affected our lives. But the one thing, of course, which does remain is having to go to the shops to get food, to get provisions, to get medicines, and so on. And going to the shops itself imposes a number of problems, a number of issues, a number of challenges. The shopkeepers themselves have gone to a lot of trouble to make their environments as infection prevention free as possible. Most of the shops have sanitizers as you go into the shop and allow you to sanitize as you come out again. Many of the shops have limited the number of people going into the shops to prevent crowding inside the shops, and also to have queue management. Queues going into the shops to be distances as far as possible, and also queues waiting at the cashier. But what can you do as a customer to limit your chances of picking up infection? And for this, I've devised Prof Schoub's 8 rules of shopping during the lockdown period. Rule number 1 is to try and minimize the number of times that you go to the shops. So this is where it's really important to have a shopping list, to make out a shopping list so that you don't have to go to the shops as frequently as you used to try and keep it to an absolute minimum. That's rule number 1. Rule number 2 relates to the elderly. The elderly, people over the age of 65, certainly people over the age of 70, where we know that COVID infection is particularly serious. So people in that age group, over 65, shouldn't go shopping. And provision should be made for younger members of the family to do the shopping for them. That is rule number 2. Rule number 3 is sanitize your hands as you go into the shop. At least that there'll be some remnant of sanitizer on your hand should you touch surfaces that will inactivate any infectious material. However, having said that, please remember that your hands are not safe. Your hands do come into contact with surfaces and they can act as vehicles for transmitting infectious organisms. So here we come to rule number 4. Avoid touching your face. Avoid touching your eyes, your nose, your mouth. If your nose gets itchy, which it definitely will be while you get shopping, then at least try to rub it with your elbow and not with your hands. Rule number 5, probably the most important of all, is social distancing. Most important because this is how infections are mainly transmitted, by droplets generating from somebody who's carrying the virus. So to keep away at least a meter, preferably 6 feet away from people, in the shops, in the aisles, and also importantly when you're waiting in the queue at the cashier to pay. Rule number 6 is cough etiquette, cough and sneeze etiquette. If you do cough, if you do sneeze, please be considerate of other people. Cough into a tissue and dispose of the tissue into the garbage. If you don't have a tissue available, then into the crook of your elbow, but never into your hands, which then of course can contaminate other people or contaminate surfaces. That's rule number 6, cough etiquette. Rule number 7, you've now finished your shopping. As you're going out, sanitize your hands again. Then when you come home, this is rule number 8, wash your hands thoroughly. And these 8 rules should at least minimize your chance of infection when you do have to go to the shops, on occasions when you do have to go. Now, these are logical, rational, well thought out, scientifically based measures. There's really no need to go to the extremes which have been mentioned in various social media, and WhatsApps and so on. There really is no need to change your clothes when you come home. There's really no need to sanitize your credit cards and your cell phones, etc., etc. I think that really is unnecessary. It's going overboard. It will just simply make you neurotic. You don't need to blowtorch your credit card. And I think if you can just carry on with these sensible rules when you do go to shops, at least you'll minimize your chance of infection. The question of masks comes up now and again. It's a more, I think it requires a more detailed discussion. Maybe I can do it in a subsequent podcast. But to summarize, the World Health Organization, the Center for Disease Control in America, most of the large organizations say it is really unnecessary to have a mask if you're a healthy person to prevent yourself getting infected. Masks should be used by healthcare workers when they're dealing with infected patients, and masks should be worn by people who are infected to prevent their droplets coming out. But for a healthy person to avoid infection, there's really no good evidence to show that it does, in fact, effectively prevent you getting infected. So the bottom line is it's probably not necessary to wear a mask when you go shopping.